Hello, this is Rochelle Green, Rochelle Insurance Girl here today. Just have a quick tip for you guys. Seeing people getting gouged, absolutely gouged by some surgical facilities, or rather surgical procedures that are done in hospitals. So if I haven't made this clear, everything at the hospital is going to be way, way, way more expensive. But seriously, we are here to take control of our health. We're here to take control of our wealth. And my passion is to be your healthcare spending advocate. So I've got an industry insider pro tip for you today that could save you between 50 and 90% on your outpatient surgical procedure. If you choose, or if your doctor prefers for you to go to a hospital instead of a surgical facility for a surgery that could very well be outpatient, such as, or even a testing, something as simple as, or routine as a colonoscopy. I'll tell you about a client that I had recently whose doctor was on staff, gastroenterologist that was going to be doing her colonoscopy. The doctor was on staff at a hospital, a local hospital here, and he did a lot of gastro bypass surgery. He did a lot of surgeries where he needed to be in hospital for those procedures. However, for her colonoscopy, a lot of other doctors would go to a surgical facility, right? This was over a $10,000 colonoscopy. I know, ouch. Relative pricing for a colonoscopy with a surgical facility, anesthesia, doctor's bill is around $2,500. So, this is still happening, and who do you think is going to pay the big difference between what the insurance would normally allow and that $10,000 bill? That's right. My client, they tried to bill her for around $6,000 after the PPO repricing and everything for a colonoscopy. Can you believe this? So we have to take control of the situation. We have to get ahead of these things and make sure we're very clear on what is our out-of-pocket expense going to be before we're able to book anything. And, due diligence. I do tons of research on, procedures and facilities and healthcare costs and how to make the most of those healthcare spending dollars. So feel free to reach out to me. But my top 2 tips for making sure that you are getting the lowest out-of-pocket cost is 1, your network. Go out of your way to make sure you're seeing an in-network doctor. Whether you have an HMO or a PPO, this is going to save your out-of-pocket usually significantly. So if you can go in-network. And then number 2, that big one, the hospital. My goodness, if we can avoid going into a real hospital facility and save thousands, I don't mean hundreds, I mean thousands of dollars, let's do diligence and let's make sure that we can schedule our routine colonoscopy or whatever it might be, or even a knee surgery or something that doesn't have to be in the hospital. Reach out to me. I'm happy to help assist you with this. This is Rochelle Insurance Girl. We're doing it all just for the health of it.